Do you need to have an internal examination if you're being evaluated for pelvic floor dysfunction? That's the subject of this video. Hi, I'm Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine. Stay tuned. All right, so one of the questions that's fair enough to ask is, I have pelvic floor dysfunction. Do I need to have an internal examination? The answer is not necessarily. For one, even if you have to, it's better off, you're better off having an internal exam. If you don't feel comfortable, you don't need to have it, because we can pretty much, going by your symptoms and your presentation, we can pretty much tell if you have a more of a non-relaxing pelvic floor muscle or not. There's a difference between non-relaxing pelvic floor muscle versus non-relaxing pelvic floor dysfunction. So we're going to put a video at the end of this video so you can watch and understand the difference. But for the sake of this conversation, if you have a non-relaxing pelvic floor dysfunction, then not a problem. If it's a pelvic floor that's not relaxing, it's better to be able to go internally and incorporate the breathing techniques to get you relax those muscles as those muscles are being worked on. Now, if you're uncomfortable with that, then there are other things that can be done. It's just this is a better approach. Now, when it comes to pelvic floor dysfunction, which is more than just the pelvic floor muscle, then absolutely not. In fact, that is 100% not even necessary. So going by your signs and symptoms and presentation, and in our office, we evaluate you with the movement functions to see how well behave all these areas of your lower ab, your lower back, your lower mid back, your sacrum, sacroiliac joint, your pubic bone, and your hips, your overall posture, how you're moving around, what's the progression of movement in these evaluations. We can very clearly see what you have. So there is no internal examination needed to evaluate that and come up with what needs to be done. In fact, for the non-relaxing pelvic floor muscle, we can pretty much tell from the symptoms that you have the dysfunction there as well, at which point when it comes to treatment, that changes. So the best treatment is to manually go in and incorporate the breathing into the manual work to get those muscles relaxed. Kind of like, look at it like going to a massage therapist for other parts of your body that's tense. It's nice to have a nice breathing incorporated into that massage, have a nice environment where you're more relaxed, so the treatment session is more effective. That's essentially that, and I thought this was a good video to clarify if that's necessary or not. A lot of times people don't feel comfortable with the whole idea, and unfortunately we're seeing a lot more younger people with the dysfunction in the pelvic floor or dysfunction in the pelvic floor muscles that are just, that's kind of uncomfortable for them, just kind of, they're shy about it. It's understandable. So the answer is no, you don't have to. If you found this video helpful, please make sure that you subscribe to the channel. There are a lot more videos. We put a couple of videos a week on the very subject, and we are patients, and what's out there is the inspiration to do these video subjects. If you have any suggestions, please make sure you let us know. And until next time, take care.